They call Miami paradise, but behind its glamorous facade, an insidious virus lurks and lashes out. Over the years, I've noticed that coverage of HIV and AIDS has diminished. Part of the reason it's diminished is because of the state of the media. The newspapers and broadcasts have reduced health coverage. So I thought that one thing that we could do in my class this semester was to devote the class to building a website that focused only on HIV/AIDS on a local level, to introduce students to the idea and get them excited about reporting on it, and then also to build an HIV/AIDS resource. They too started to wonder, well, how come the media has dropped the ball on coverage of HIV/AIDS? And it was fascinating to watch them get excited at a local level, and they were shocked to discover just how severe the problem is in Miami. Parts of Miami-Dade have the highest concentration of HIV/AIDS in the United States. At the end of the semester, I created an HIV/AIDS writing competition. The two winners, Gillian Sims and Tiffany Parks, accompanied me on a journalism expedition to South Africa to report from the epicenter of the epidemic. We witnessed the staggering impact of the disease, but we also observed how South Africans, including their media, have mobilized and are fighting back. Miami, as well as the rest of the United States, can learn from their example and their commitment.
It's estimated that half of all South Africans will eventually get HIV.
The scale of the epidemic is so huge in South Africa, with 19% of the sexually active population infected, 12% for the population as a whole. It's so massive, and the impact on people's daily life is so great that people are forced to react to it.
You can so mobilize the media to actually push a health agenda that it's incredibly powerful. And I think HIV has pushed the health agenda.
Because our government has not taken the lead in terms of creating awareness around HIV and AIDS, it's been civil society that has done that. And that pressure can be quite clearly seen in the coverage that we're getting in media now, that there's much more openness to it. There's many more stories coming out that work around people and people's lives and how they respond to something.
My view of journalists, in fact, in this country is that they've done a superb job. They've kept it on the front burner, they've thrown it in the face of government, they've tried to find creative ways to deal with it, they've pushed their sub-editors and their editors in ways which are very creative. So I actually have quite a lot of respect for journalists in this country.
People write in and tell us their own stories about living with HIV. And a lot of those stories are very powerful. You often imagine yourself in the place of that person because they're dealing with situations that you recognize. They even sound like people that you might know quite often. It brings home the notion that HIV is something that affects every single one of us, and that we need to respond as human beings to other human beings. It does get beyond the numbers, because the numbers can be very numbing. And we come out every week, and every single week we've had a story from somebody. It's been quite astonishing. People want to write. They do. For some people, it helps them process the grief of losing someone, or helps them come to terms with HIV in their own lives. Others want to share their stories. Others want to respond to something that they've read in the paper. They identify with somebody whose story has already appeared. And some people have kind of come through a journey, and they have insights which they can offer to other people who are in the same kind of situation. I've been doing AIDS since the mid-80s, when the plague started. The epidemic started, and it does creep up on you, after 20 years with it. You just feel as though you've had enough, and even the things that you've learned and preached sometimes are hard to apply in one's own life. So I think AIDS fatigue is very real. The media in South Africa, however, has done a fantastic job, though much less so on the television side. What we've done, indeed, is basically created a real reality show, not what commercial television calls reality TV, a real reality TV, using the lives of people living with HIV.
The host of the show is also HIV positive. We get together, we share experiences that we've been through as HIV positive people, share ideas, sharing those experiences and stories, it helps the people, right? And I believe we are the inspiration.
People get attached to these characters, identify with them. They have tremendous human dramas around sex and love and disclosure and periods of illness. Why did 750,000 people watch Busi's story of her disseminated TB? They watched because they'd already come to love Busi as a character.
I've just found the lab pussy and your baby's PCR result is negative.
We're in Khayelitsha and we are busy shooting a documentary insert for a mother who's using cup feeding to prevent her baby from becoming HIV positive because she is positive.
This is a TV show that's been linked to a social movement around HIV/AIDS represented by the Treatment Action Campaign. And we would not exist and we would not have had the success we've had if it wasn't for that link.
We started putting pressure on our government to start providing medicines to prevent mother-to-child transmission in 1998 when we started. The campaign really got going in 2000. And yet there was no movement from our government on this.
Here in South Africa, we've continued to have a denialist stance at the top of government and consequently in the Ministry of Health.
I think that both of them have played an unbelievably destructive role in our approach to HIV, and I think the downstream consequences of that are going to be felt for decades.
Today we are here to ask President Mbeki to develop a treatment plan for people with HIV. We here say to our government, don't waste money on arms, on scrap metal. Invest it in our lives.
And so we ended up taking our government to court. And eventually in 2002, the Constitutional Court of South Africa, which is the highest court in the country, ordered government to provide a mother-to-child transmission prevention program.
The steps that have to be taken to comply with the order that we make should be taken without delay.
Now is the time to stand up for your right. Treatment now.
Nowadays, government provides antiretroviral treatment free in the public health system.
The funny thing about HIV is it lends itself to a certain activist mentality, even amongst the journalists, I think, and that's been really fascinating for me to watch. Certainly in South Africa, it's the mobilization of the media around the conflict between the TAC and the government has actually, I think, given a lot of people a sense of what the power of civil society can be.
Imagine if in Florida there was still a New York-style act-up that was mobilizing people and fighting for the rights of people. That would make it easier for people to speak out.
But in Miami, the struggle is not taking place in the streets. The war is largely being fought in academia.
In 1994, I came to FIU because I thought I could do something to help alleviate the problem in South Florida. By the way, at the time, Miami and Broward County had the highest infection rates of any place in the United States. And I further found out that among young people, 18 to 25, the 4 counties with the highest HIV infection rate were all in South Florida, in the entire country, in the entire United States.
In the early 90s, the fact that people know getting infected with that was a death sentence, and they saw the people getting sick. They saw the people that are with the wasting syndrome laying down the skeleton. They feared getting infected with the disease. And since the disease is being managed so well with the grace of God, and we have to be thankful for that, I think that fear factor is gone. The gay males now are getting less and less because of the fact that they are more powerful, as in asking their partner to use barriers, when they are being in sexual contact.
But we've got 5.5 million people living with HIV. Most probably about 1.2 million need treatment now, but down the line, more and more people will need treatment. But at the same time, we're trying to use communication to prevent infection. I mean, studies show that 66% of South Africans believe they are not at risk of HIV. And yet, Of those 66% in this particular study, 12% tested positive. The mass media programs really help to allow individuals to exercise a range of choices in trying to prevent HIV.
In the year 2000, we realized that there were very few films that were addressing HIV and AIDS in Southern Africa, at least films made locally that people could relate to. We decided to make a collection of films by local filmmakers that would address the issues. I think what was very crucial for us was that we were making documentary films and not drama. Because dealing with an issue like HIV and AIDS, it's really important that people feel something out of those films. Where we would have a film screening, we would have somebody who would guide the discussion and be able to provide the information that people were starting to ask questions about. So what we were noticing after the screenings is that many more people would want to go and test for HIV. And that was an important breakthrough. There was a lot of discussion going on in the communities where the film's being screened. And you could start seeing the parallels between what had happened before and what is happening later.
Doctor recommended an HIV test. The results came back positive. The doctor did not provide any counseling or explain what is HIV all about.
When people think about South Africa and they think about the response to AIDS, it's often nothing's being done because that's more or less the popular opinion that has been expressed in the media, especially in the Western media. In South Africa, condom use at last sex in 1998 was 20%. More recent studies are putting it just under 70%. I mean, that's a phenomenal growth in condom usage. Testing a couple of years ago wasn't even readily done. We now have about 30% of our population being tested. But I think the unsung heroes of the AIDS response in South Africa and in the rest of Africa too are the people that are working at community levels trying to make a difference in the lives of people. And it's not just making a difference in the lives of people living with HIV, but it's also trying to prevent new infections. The one thing we often forget when we talk about AIDS in Africa is that the majority of Africans are still negative.
I'm fairly angry with the media as it is, because it distorts information, it gives people the wrong kind of information. They capitalize on the little things that HIV medication does, that men in Mpumalanga had breasts, so that they have to go and put the men in the front page, on the front page, so that people can see the bad of the antiretrovirals, forgetting that these things can actually give you life if used properly, if properly monitored as well.
Because on the one hand, this actually is the reality. That is what the drugs do. The second thing is that it's often underestimated. It's underspoken about, and that there's often doctors don't do their duty and warn patients that when you see the first signs of breast enlargement, tell us and we'll switch you to another safe drug. On the other hand, it did scare the pants off patients. So you have this very difficult thing where if I was a patient on this stuff, I actually would want to know that this is a side effect. HIV is hard scientifically. Some of the concepts and things are very difficult for an untrained person to deal with.
We have journalists who we take out of the media rooms who we will pay to come and do in-depth research on a particular topic. We try and get an aspect that isn't being covered by the media. People are getting tired of reading the same sorts of stories all the time. So what's new? What's different? What hasn't been covered before? We have a website called JournAids, which we put on various facts for the media. We go into the university and we train postgraduate journalist students on basic facts about HIV. Because even though the prevalence in South Africa is so high, and there is quite a lot of coverage, journalists do not understand the basic science of HIV.
The disease has kind of changed in so many ways. It kind of started off as being something which was a death sentence. Then there were ARVs, and that gave hope to people. We've also had people who've been orphaned, who are now growing up, and each of these stages is presenting new challenges and demanding new responses.
FM Talk, focusing on health and lifestyle issues with Griselda Commander, fighting negative mindsets, embracing a positive lifestyle. Metro FM Talk on Thursday, 7 to 9 p.m.
Good evening and welcome. It's a Thursday night between 8 and 9. We focus on HIV and AIDS related issues. When we say never give up, what does it mean to you? What have you been going through? Were you looking at this message and you wanting to formulate something that can help you to stop HIV and AIDS and never ever give up? And remembering that millions of people have died to date. I've broken down what we mean by AIDS. And that has kept it very interesting, that when we talk about acquired immune deficiency syndrome, it's a syndrome that talks to 30 different ill conditions. And within that, there are societal issues, there are economic issues, there are political issues, and I make it relevant to what we currently going through, as opposed to just focusing on HIV infection as just a sexuality disease.
People need to understand what it means to go on antiretrovirals. They need to understand that before you go on antiretrovirals, there's a lot that you can do to delay the onset of AIDS from initial HIV infection. It's nutrition, it's healthy living, it's having a positive attitude, physical well-being, making sure that opportunistic infections are treated as soon as they appear. All of those things have an impact on a person's health. So if we can get people educated about how to look after their health, we can delay the impact of AIDS, which means we delay the start of treatment. However, once people go on treatment, people need to understand you have to take these tablets for the rest of your life. I mean, that's what makes treatment work. People have to understand that you also still need to eat well and eat properly. People need to understand that there will be side effects, and I think we need to use communication to prepare people.
Are we doing enough? Are we really educating people? Are we really targeting them to educate them to be able to understand that it's possible to live with this disease? But most of the time, you just find people like us who are just, nobodies, and then they're just talking about their status. But key people that need to be saying something and giving hope to people, they don't do it. They really don't do it.
I look after senior politicians, I look after media celebrities, I look after sports stars. They don't tell people they're HIV positive. Why are we expecting now suddenly security guards, domestic workers, the unemployed, the psychiatrically ill? They must be the first ones to disclose their status, force them to put their status out on the line and what they died of. For me, stigma is very much about the sense of shame that people often carry with themselves. And I think as health professionals, we battle to deal with that because it doesn't look like a sexually transmitted disease. They're coming with TB, with meningitis, with pneumonia, which are common and garden medical things. It doesn't look like a sexually transmitted disease. The community and the patients identify with the fact that it's a sexually transmitted disease, and all the stigma and complex sort of judgments they perceive from the society related to being sexually active and having acquired an illness.
People live within social networks, which are their friends, their families, their peers, and those people impact and inform their behavior. So if people are going to change their behavior, they need to have a conducive environment that allows for them to change their behavior.
The ideal situation would be having a one-on-one conversation with every single person in the country and explaining to them what the advantages are about getting tested, knowing your status.
I got involved in HIV about 3 years ago. I know from personal experience how important brands are in people's lives, but defining who you are is an important thing, just as important to a kid in a township as it would be to a kid in the middle of New York City. So getting brands on board, I think, is a really critical new step in trying to address HIV.
And back here at home, Levi's Jeans is making it hip to be tested for HIV and AIDS.
And we're in a parking lot of a very ordinary suburban mall. And you'll notice there's something a little bit different behind you, and those are tents. And inside those tents are counselors and a little testing station where you can get very rapid results, whether you're HIV positive or not. But it's part of an innovative approach, I think, which is to try and combine convenience and brand name with public health. It's trying to get people to reassess what this means to take care of themselves, to integrate the reality of HIV's existence into their everyday life, and also just to give them an option, give them a strategy to deal with it. So it's brought to malls, it's brought to schools, it's brought to train stations, communities, churches. On a typical day, you'll get 50, 60 people. On a really busy day for these counselors, they'll get over 100. And the remarkable part for us is how willing people are to come to a very open public space and go through a test like this, which some people think is such a scary, personal thing.
We're located at Jackson Memorial Hospital, and it's right in the heart of Miami. The chance of meeting somebody that you know while you're coming to clinic is very, very great. Clients will leave home ready to come for treatment and meet somebody that they know at the front door, and they will walk right past the clinic and go. Some churches are still not allowing people in there. Even if we go and talk, we cannot bring condoms and things like that. And with some populations that with teenagers, we have to be very careful, or we present things to that population, school-age kids, even though they are getting infected also at a high rate.
There's a lot of things in culture and tradition that are good for HIV, but there's also a lot of things in culture and tradition that need to change if we're going to stop new infections. So it's always about trying to strike a balance between those two.
There's a lot of pressure on young girls in particular to have sex at a earlier age, but also it's around money, sex and money. Where do you get your new clothes from? You have sex with someone who's older, they maybe buy you a new dress. And there's a lot of transactional sex.
I think the media is to blame for refusing to continue to look at the problem and to report on it. More importantly, our politicians are, certainly in the state of Florida, with budget cuts. What was the story in today's Herald about budget cuts? The first thing that's going to be cut is public health clinics, public health services. There is no lobby for homosexual men that's effective, for women who unfortunately have to engage in prostitution, and the people who suffer most as a consequence of neglect on the part of the public for dealing with the problem.
We're not going to stop people from having more than one sexual partner. We're not going to stop kids from having sex, but we have to make sure that people have the information to exercise the choice that is best for them. Women tend to be much more open about their status, and women also tend to be much more aware of their status, partly because they interact with the clinic system a lot more than men. Men are more inclined to see traditional healers and do not interface with the clinic system that much. But when we look at HIV, what we do know is that men are being infected at much later ages in life, from about 25 to 39, and women are being infected at an earlier age, which is around about from 15 to 24. So we really need to look at trying to get men to be more open about their status.
Men do not come into care, not just in South Africa, but across the world. If you can draw them into care saying, I care about you as a male, and these are the following 6 or 7 health interventions I want to do with you, I think we could actually do something really radical here and revolutionary. And we could take a group of people who do not access healthcare until they're practically dead and move them into the system in a way that we've never done before. We have one of the best condom distribution programs in the world. The numbers keep going up. There's no debate. So something's not working in prevention. What are we going to do differently? Now, circumcision for me is one of the options. Scientifically, it works. I don't think there's any doubt at this point that it works. How you implement it in a country where there's quite different cultural practices, I think has to be handled sensitively and carefully. That doesn't mean you don't do it urgently. There is scope to actually have a really major intervention that will value men as something beyond simply the mosquitoes of the epidemic.
If we can't do that, we're not going to win this epidemic. This is not about women. It's about 2 people in a relationship, or more, depending on how many partners they have. But it's about those people in the relationship taking responsibility, and it's about men. I think men are actually the solution to HIV and AIDS, not necessarily the problem. And I think that with women, for too long we have shown women as the face, and therefore often women carry the burden of being blamed. And I think we should actually start talking about men, and male behavior is a key driver of this epidemic today.
Thanks to the work of Richard DeLate, Francois Fenter, and others, I returned to Miami with a new understanding of the challenges of controlling HIV/AIDS. and the realization that our media have much to learn from their South African counterparts about mobilizing and better informing the public so we can stop the spread of this devastating disease.